Maggot therapy. Maggot therapy, also known as larval therapy, is a type of biotherapy involving the introduction of live, disinfected maggots or fly larvae into the non healing skin and soft tissue wounds of a human or other animal for the purpose of cleaning out the necrotic or dead tissue within a wound, that is, debridement, debridement and disinfection. There is evidence that maggot therapy may help with wound healing. Medical uses. Maggot therapy improves healing in chronic ulcers. In diabetic foot ulcers, there is tentative evidence of benefit. In 2004, the United States Food and Drug Administration cleared maggots from common green bottle fly for use as a medical device in the US for the purpose of treatment of non-healing necrotic skin and soft tissue wounds. Pressure ulcers, then venous stasis ulcers, neuropathic foot ulcers, non-healing traumatic or non-surgical wounds, etc. can be treated. Some limitations are also there. The wound must be of a type that can benefit from the application of maggot therapy. A moist, exudating wound with sufficient oxygen supply is a prerequisite. Not all wound types are suitable. Wounds which are dry or open wounds of body cavities do not provide a good environment for maggots to feed. In some cases, it may be possible to make a dry wound suitable for larval therapy by moistening it with saline soaks. Patients and doctors may find maggots distasteful, and although studies have shown that this does not cause patients to refuse the offer of maggot therapy. So, maggots can be enclosed in opaque polymer bags to hide them from sight. That is useful, I guess. Maggots can be enclosed in opaque polymer bags to hide them from sight. Dressings must be designed to prevent any maggots from escaping while allowing air to get to the maggot. Dressings are also designed to minimize the uncomfortable tickling sensations that the maggots often cause. Mechanism of action. The maggots have four principal actions: debridement, disinfection of the wound, stimulation of healing, biofilm inhibition, and eradication. Biology of maggots. Lucilla sericata, green bottle fly. Protoformia therenova way, that is the northern blowfly. Green bottle fly and northern blowfly. Those flies whose larvae feed on dead animals will sometimes lay their eggs on the dead parts, necrotic or gangrenous tissue of living animals. The infestation by maggots of live animals is called myiasis. Some maggots will feed only on dead tissue, some only on live tissue, and some on live or dead tissue. The fleas used most often for the purpose of maggot therapy are blowflies of the Californidae, and the blowfly species used most commonly is this green bottle fly and common green bottle fly. Another important species is also notable. That means northern blowfly is also notable for its feeding secretions which combat infection by Streptococcus pyogenes and Streptococcus pneumoniae. Lucilla sericata or green bottle fly. Next, northern blowfly. Veterinary use. The use of maggots to clean dead tissue from animal wounds is part of folk medicine in many parts of the world. It is particularly helpful with chronic osteomyelitis, chronic ulcers, and other pus producing infections that are frequently caused by chafing due to work equipment. So, maggot therapy for horses in the United States are reintroduced after a study published in 2003 by veterinarian Dr. Scott Morrison. This therapy is used in horses for conditions such as osteomyelitis secondary to laminitis, subsolar abscess leading to osteomyelitis, post-surgical treatment of straight nail procedure for puncture wounds infected in the navicular bursa, canker, non-healing ulcers on the frog, and post-surgical site cleaning for keratoma removal. However, there have not been any case studies done in maggot debridement therapy on animals, and as such it can be difficult to accurately assess how successful it is. Extension. This is about dipteran biosurgery, same topic. A biofilm is any group of microorganisms in which microbial cells stick to each other and adhere to surface of injured site. It acts as a barrier for wound healing. Debridement is defined as the removal of dead, damaged, infected tissue to improve the healing potential of healthy tissue. If debridement doesn't take place, wound repair is significantly damaged. Regular clinical approach for chronic wound with biofilm includes physical debridement, and antibiotic treatment. However, limitations of these debridement include low efficacy, high morbidity, and secondary infection. Maggot excretion, secretion, salivary gland extract, and its physical action prevent the formation, inhibition, and breakdown of biofilm. This therapy is called maggot debridement therapy (MDT) or biosurgery by maggots. It is type of biotherapy or biosurgery in which live disinfected maggots, fly larvae, are placed into the non-healing skin and soft tissue wounds of humans or animals to clean out the necrotic dead tissue within a wound. That means debridement, and to disinfect the same. Australian Aborigines used maggots to clean wounds for thousands of years. The French surgeon Ambroise Paré, I'm not sure about the pronunciation of scientific names and people's name, was the first doctor who observed the cleansing action of maggots in wounds. He noted the beneficial effects of myiasis in wounds of soldiers on the Battle of St. Quentin. In 1917, William S. Bayer, founder of maggot therapy, William S. Bayer, a military surgeon in France, reported this treatment of open fractures and stomach wounds with maggots. He, in fact, went on to call maggots as viable antiseptics. Commercially produced surgical maggots, larvae of the green bottle fly, which primarily feed on the necrotic tissue of the living host without attacking living tissue. The extensive use of maggot therapy prior to World War II was curtailed when the discovery that growing use of penicillin caused it to be deemed outdated. However, with the advent of antibiotic resistant bacteria, Dr. Ronald Sherman reintroduced maggot therapy into the armamentarium of modern medicinal care in 1989. The therapeutic maggot used by Sherman et al. Is a strain of the green bottle fly and marked under the brand name Medical Maggots. In 2007, preliminary trial maggots were used successfully to treat patients whose wounds were infected with the bacterium Streptococcus aureus and resistance to most antibiotics, including methicillin. Commercial medicinal maggot flies. The infestation of live human and vertebrate animals with dipterous larvae is called myiasis. MYIASIS. There are mainly three dipteran families which cause this myiasis: Californidae, Sarcophagidae, Estridae. Biosurgery using maggots. Procedure: eggs are harvested immediately and are washed several times with 70% alcohol and distilled water. After hatching, maggots are again washed 3 times with 70% alcohol and distilled water. Maggots are ready for commercial use. Each vial contains approximately 2,000 eggs. Each vial also contains sterile food containing soy protein and yeast. Maggots can be removed easily by wiping them off the sides of the vial with a case pad moistened with sterile saline or water. Special type of dressing called the creature comfort dressing, made up of polyester netting, is assembled with other dressing material to create a confining cage dressing which allows air to enter, drains out necrotic tissue. The maggots are removed from the container by using a few ml of saline. The maggots are placed on the net with use 10 maggots per centimeter square surface area of the wound. The net is turned to place the maggots into the wound cavity. The net is fixed with water-safe wound tape on the hydrocolloid surface. A non-woven gauze, slightly moistened by saline, is then placed on the surface of the net to give humidity to the maggots. Later, the maggots produce the humidity by their own secretion. Then more dry, non-woven gauze is placed on the top of the moisture gauze and fixed by a gauze bandage, and patient is then mobilized without pressure on the maggots. The maggots have 4 principal actions. Debridement: maggots selectively consume only necrotic tissue and debride wound in 2 days. Each maggot is capable of removing 25 mg of necrotic material within 24 hours. They have modified mandibles called mouth hooks, and they have some rough bumps around their body which scratch and poke the dead tissue. This probing and maceration of wound tissue with maggot mouth hooks enhance debridement. Maggots are covered by minute spines which scrape along the wound base as the maggots crawl about, you loosening debris and does a surgeon's rasper. The maggot does not bite off pieces of tissue, but it rather secretes and excretes its digestive enzymes. They derive nutrients through a process known as extracorporeal digestion by secreting a broad spectrum of proteolytic enzymes that liquefy necrotic tissue and absorb the semi-liquid. In an optimum wound environment, within a period of 3 to 4 days, they ingest necrotic tissue, leaving a clean wound free of necrotic cells. Disinfection, allantoin, phenyl acetic acid, phenyl acetaldehyde, calcium carbonate, and proteolytic enzymes, ammonia, etc., are the secretions of maggots that inhibits the growth and development of bacteria. Biofilm inhibition. Biofilm is structured community of one or more species of bacterial cells living closely in an enclosed protective self-protected polymeric matrix and adhered to living surfaces. Maggots' excretions and secretions is capable of dissolving biofilm and inhibiting growth of new biofilm. Stimulation of healing. Proliferation of fibroblasts, cells found in connective tissues that synthesize collagen, which is responsible for muscle cells connection required for wound healing, and endothelial tissue increases. Angiogenesis, formation of new blood vessels take place. Advantages and disadvantages. Maggots separate the necrotic tissue from the living tissue, which make a surgical debridement easier. The offensive odor emanating from the necrotic tissue and the intense pain accompanying the wound decreases significantly using this MDT. MDT seems to be an effective and environmentally friendly treatment of complicated necrotic wounds that are resistant to conventional treatment. So it takes about 50 to 30 minutes to apply. It is simple enough for even non-surgeons to use it. Effective against both gram-positive and gram-negative bacteria. It promotes healing of diabetic foot wound by upregulating endothelial cell activity. Its use could prevent amputations and minimize the need for prophylactic antibiotics to avoid kidney and liver toxicity. The disadvantages include patients and doctors may find maggots unpleasant. The limited availability of medical maggots. Maggots have a short shelf life, which prevents long-term storage before usage because they mold and pupate or may die if they are not provided with enough nutrition. Sometimes the therapy can be painful, especially in the first few treatments after 24 hours due to increased size of maggots and due to crawling over exposed nerve endings.